Good afternoon. I am Dr. Arnold Kremer, and this is Sandi Star, my associate. We practice functional medicine together. I am a physician, obviously, and Sandi is a holistic health practitioner as well as a nutritionist.
Yes, so we're really excited. We want to actually present to you today. We'll pull up some slides and we're going to talk about adrenal health, which is really the foundation of where we start in the functional medicine program for a good reason. So I'm going to go ahead and share this. If it'll come up. There we go.
Oh, well, I know them.
Yeah. Okay. So we're going to go ahead and address stress and hormones. This is us in picture form.
Right. It's about the best picture I have of me. So
yeah, we're working on that.
You'll see it for the next 20 years.
Right. So really our program is doctor-led with an interesting background between us, many years actually, in different areas of medicine. And that's what makes it nice, is because we get it. We both personally use functional medicine and have seen quite a difference in our own testimonies. And the goal really is to get to the root cause. That's the bottom line. Get to the root cause of chronic health conditions so you can heal. And we do that through specific labs, very comprehensive labs, lifestyle, diet, mindset, stress management, all of that. We really go deep. It's really important to do that, to be able to get underneath the current and get that tide a little calmed down.
So what brought me into this interest in functional medicine was I was an emergency physician for 41 years, and what I realized was 85% of the people are in there because of poor choices. Some of them were conscious of their poor choices, and some of them were just didn't know they were poor choices. Right. And so functional medicine, we try to find out what is the root cause of problems and teach people to improve.
Yeah. So really the overview today is common health complaints, hormone system, adrenals, stages of burnout or just adrenal fatigue. There's stages in that. And then obviously we do the lab. We'll talk about that and kind of what is this hormone? What does it do? What's good and bad about it? And the 5 most health
So here's the funny thing. Most people have come in and they say, well, what is bothering you? And usually they fit into these 5 categories, one way, shape, or form. I've gained too much weight. I'm tired all the time. I'm anxious, depressed. My hormones are imbalanced, or I have a gastric problem on bloating or gas, or some of them have diarrhea, constipation. But I mean, all these, and so. They ask, well, what do I have to do? And our job is to figure out what the problem is.
Yeah. And underlying causes, as Dr. Kremer mentioned, it's lifestyle. Actually, our genes don't dictate our health. It's our lifestyle, and how our lifestyle can dictate how these genes express themselves. And so lifestyle and food choices, stress management, hormone balance, imbalance is one of the causes. So balancing that out, stress management, and medications, even self-medicating on supplements is a big area where it can actually do damage. Especially if you're on, the average American is on like 7 to 17 medications at once. And so of course the body's going to get a little confused.
And also one of the other problems with even just supplements is a lot of people will just go to their local store into the health food section or supplement section, and they'll say, oh yeah, I need zinc, I'll get this one. They have no idea what the branding is, what's really in it. And there's been like so many studies that show that some of these supplements, some of them don't even have the supplement in it that they advertise to have in it, or they it's altered some way. So it's important to get the proper supplements
and guidance on that. There's no FDA regulations for supplementation, not that we really want them at this point, but and so that's where self-medicating can become pretty dangerous. So again, the hormone system, why don't you go ahead and share how amazing it is?
The hormone system it really controls our body. It helps to regulate our energy production. It's good for fat burning and our mood. And when there's an imbalance, you're going to get a problem with mood, or you're going to gain weight.
Yeah.
So the adrenal glands are one of the main producers of hormones. They regulate your stress. This is a great diagram. That's me under X-ray. But you can see the main thing is that if you look at the adrenal glands sits right on top of the kidneys.
Very tiny little glands too.
By the way, there's a norm that this doesn't show, but there's actually 2 kidneys, 1 on each side, and the adrenal gland. There's 2 adrenal glands.
Yeah.
So so the adrenal glands are hooked right in with the hypothalamus pituitary glands, what we call the HPA axis.
Yeah. So then you think about thyroid hormones, sex hormones, adrenals, DHEA, all these different things that are involved. It's amazing.
One of the interesting things that people don't realize is that we all, men and women, both have testosterone. But the testosterone in women is actually produced in the adrenal glands.
Yes. So if a woman's going through menopause or has been through menopause, the adrenals are critical to keep healthy because they're the ones that are going to help with your hormones, right? Testosterone, things that you need in the body.
And they produce estrogen and progesterone once you've gone through menopause. So
right, because your ovaries aren't working. So so the body's amazing how it has other parts take over when it's needed. So adrenals, very important if you're in pre, or post menopause, honestly. Okay. So the importance of adrenal health, obviously, we kind of talked about that. Do you want to add anything more on that?
Just the fact that the balance is the important thing. If you have too much or too little, it's going to and the stress hormone, especially cortisol, is very important because all of us, guess what? We live in a stressful society.
Yes.
I know everybody put your hand up if you agree, right?
Right? Yeah, exactly.
And so the cortisol goes up, and when that cortisol goes up, it's all right if it goes up for a short amount of time. That's its purpose.
Sure.
But if it stays up in a long period of time, it messes with our immune system, which 75% is in the gut, and it messes with our adrenal glands. Our adrenal glands get tired of producing this stuff. So you get into exhaustion. These are the 3 stages of overload.
Yeah, I mean, you get stressed, it becomes chronic, you start getting fatigued, and then things add on, and then COVID hits and people are, in a different mindset, and then you're exhausted, right? So when you get exhaustion, your adrenals are not working correctly, and that's when we really need to hopefully address it before exhaustion, but definitely an issue. Yeah.
So this slide is good because it tells you what the purpose of cortisol is.
Yes.
It mobilizes and increases your amino acids. Now, the amino acids are your building blocks for your proteins and the blood and liver, and converts amino acids to glucose when necessary.
So it monitors glucose.
And also stimulates increase of glycogen in the liver. Now, glycogen is the way glucose is stored in your liver as glycogen. Yeah. And so mobilizes and increases the fatty acids in your blood to be used for fuel for energy production.
Yeah.
And it's an anti-inflammatory. Just like as some of you are, I'm sure, familiar with the cortisone. And when do you get a cortisone shot? When things are inflamed, like in a bad joint.
Right. Yeah.
And so cortisol is that same drug, basically.
It's the active form of cortisone, right? So they tie together.
Right.
One's active, one's kind of more the storage, if you will.
And so it also prevents loss of sodium in the urine, helps maintain blood volume
pressure,
and your blood pressure. That's kind of important. Yeah. And maintains resistance to stress.
Yes.
Infections, physical trauma, emotional trauma. Right. And so when does your cortisol level go up? You see a big bear. Guess what? I'm getting out of here. your cortisol level goes up
Rightfully
and
so.
makes you run faster than any Olympic marathon runner.
Exactly. So isn't it safe to say if somebody's dealing with high blood pressure, we should be looking at cortisol, we should be looking at adrenal health, stress management, right? So again, this is getting to that root for a chronic condition like high blood pressure.
Right. So this slide kind of shows what happens when there is an imbalance in the cortisol level.
Right.
So you're going to get instead of getting a good utilization of glucose, you're going to get a diminished cellular utilization of glucose.
Yeah.
And so you're going to have increased blood sugar levels. It decreases protein synthesis. Now, this is an important concept right here. If you're not synthesizing protein, your body needs that protein for energy. And what it'll do is eat your own body. Yes. It'll take it from the intestinal tract. It'll take it from your muscle.
Yeah, goes for muscle first.
So we always have to be aware of that imbalance. Increases protein breakdown. That's what I was just referring to in the muscle atrophy. Yeah. And it will cause demineralization of bone, which is osteoporosis.
Absolutely. And look at this, shrinking lymphatic tissue. That's crazy. Yeah. Because we need our lymphatic system.
That's right. That's part of our immune system.
Right.
And it diminishes lymphocyte numbers and functions and lessens secretory IgA. Which is a protective. Yes. It's almost, think of it as like a
first line of defense.
Yeah, it's almost like a mucus lining. It protects your mucous membranes everywhere. So.
Right, exactly. So when we work on gut health, we're really looking at this area as well. We test for the SIGA, SIG-A. We test for that because we want to see how the body's responding to things that are coming in. So this is a lab we do for it's a salivary 4-point test, right?
Right.
Yeah.
So this is this will check your cortisol levels, but it also will give us your DHEA levels. Right. So in this particular example, this is a normal. The blue line is the normal cortisol
trend.
Pattern. When you wake up, it's high, and then if you take it an hour or so later, it comes down. Then it gradually goes down the rest of the day till you go to sleep. Well, guess what? Some people, it's like all the way up here, and so
way up here.
And when it stays up there, you need your DHEA to help support that cortisol level.
Yeah.
So look at this. This particular one is just as an example. Very low DHEA.
Yeah, 71. Yeah.
Yeah. So how would we? So first of all, we have to determine. Well, all right, this is a little high, but it's not. But low DHEA. So this could actually, because it was high, the DHEA is working really hard to bring it down, and it's brought it down, but now it can't get up again.
Right.
And the DHEA is too low. So one of the things we would do is give this person DHEA as a supplement.
Which is a simple solution for that.
Right, exactly.
It's a supplement, it's not a medication. It's
it's a hormone. It's a hormone.
Yeah.
And we give them pregnenolone too. Pregnenolone is the mother of all hormones, goes to DHEA, then it spreads out to whatever you need, estrogen, testosterone, etc.
But it's really addressing kind of what's going on. There's an imbalance. We got to fix that, put it back in homeostasis. Once that happens, things start shifting systemically. So we start seeing actual good results. Yeah. So there are diet and lifestyle tips. Honestly, it's just being simple with things. It's just knowing, eat when you're hungry. Don't eat all the time when you're not hungry, or, connecting emotions to eating, things like that. A balanced diet. You definitely want good lean protein. I'm an organic person. I eat almost all organic foods for a good reason. Watch, sugar, eat 25 grams or less sugar a day, does not include fruit. Men, about 35. Just kind of as a guide to, when you start reading labels, you start realizing there's a lot of sugar in a lot of things, and it adds up quickly.
Yeah, that's another thing I always like to recommend is learn how to read labels.
Labels, yes.
And we teach you that, of course, but it's a constant research thing. I mean, sometimes when I look at a label, I recognize 90% of the stuff on there, but I'll see like one other thing. Well, what the heck is that?
Yeah, if you can't pronounce it, don't eat it. Right?
Exactly.
Yeah, sticking to whole foods, really.
And some of these are common things we know. Drink water. You should be drinking water all the time. In fact, I just started getting this sparkling water. It has a little magnesium in it.
Yeah.
And it's made me, because I like it, it's made me drink more water. And I kind of noticed that I just feel a little better. I thought I was drinking lots of water before, but maybe not quite enough. So
it could be the magnesium too.
Yeah.
Most people are deficient in magnesium, which is really good for the nervous system, right?
Good for blood pressure management.
Absolutely. So the other thing too is fiber. We definitely want to increase our fiber. Water, you should drink half your body weight in ounces a day, ideal body weight. And most people don't do that. We want to obviously reduce inflammatory foods, alcohol, things like that, caffeine, if that affects you, exercise, movement, prayer, meditation, things like that.
Yeah. So everything really comes down to lifestyle.
Yes.
And I mean,
balance.
we try to get you all balanced when you're out of balance, but eventually to stay in balance is lifestyle. And I'll give you one example. So some people, and I fit in this category, when I'm stressed or, like I've been busy all day and I get home, it's like I want to eat, I get a bag of, peanuts or whatever I just want to chew. Well, one of the things you can do is find the substitute for the thing that you shouldn't be doing.
Right.
So exercise is a great one. So
go for a walk instead.
Right. Take a walk around the block. I have a dog, so that makes me take a walk, and he always lets me know that hey, Arnie, you need not to eat. It's time to take a walk.
Yeah, I think I need a dog. My cat thinks he's a dog, but not quite walkable. So and then supplements and hormone therapy as needed. And that's where you really need to work with somebody who knows what they're doing, who really knows your individual needs. There's not one size fits all in any plan. It supplements anything, right? And especially even food. I always look for those trigger foods. What's going on? What are you reacting to? And then the gut. We're going to do another one on GI health. That's going to be awesome because that's a good one too. So if you're ready to heal, we do offer a free consultation. We can, kind of talk about the functional medicine program, what that looks like. We run 3 labs, all inclusive for a 6 and 12-month program. So you can either go to our website, dmfunctionalmedicine.com, give us a call at the office, or you can email me direct and we can get on the calendar to chat and kind of go from there. So hopefully that was helpful. We just look forward to sharing more information and getting this out there because it's so important to get to the root cause when you're healing. So we really appreciate you being here, and we'll see you next time.